My name is Emily. I've chosen to do this project by myself. We're going to be looking at part of chapter 15, which focuses on hallucinogens, psychedelics, and club drugs, but I'm taking a closer look at the empathogens and entactogens section of it. Empathogens and entactogens are two categories of drugs which temporarily change the user's perceptions and emotions. And first we're going to look at empathogens. And some of the properties of these are that they enhance empathy for others, and the users feel more socially connected and more available to have open conversations when using. Increase loving feelings for themselves and others around them. And these properties make these drugs popular at clubs, raves, music festivals, and other very crowded events. And the term was first used by American psychologist Ralph Metzner in 1983. So here we have a few of the drugs that are labeled as empathogens. Firstly, MDMA or ecstasy, which is what we're going to be taking a closer look on. MDA, methadone, MBDB, PMA, butylone, and then there's a lot more. And here I've just included a picture of ecstasy tablets, which I just found online on CNN's website. Entactogens are pretty much the same as empathogens with just a few differences that make them unique. Entactogen means touching within and involves introspection and openness when it comes to communicating hard things and deep feelings. And this term was made by American pharmacologist David Nichols, and he thought that people would confuse pathogen with empathogen, and pathogen means virus, so he really just wanted a different term, but there are similarities and differences with the two terms. A lot of the drugs that are labeled as entactogens are also labeled as empathogens because of the similarities, but some of the differences besides MDMA is GHB, phenethylamines, and amphetamines. And now we can look at the psychotherapy aspect of these drugs. So because of the properties of these drugs, it has sparked curiosity in the world of psychotherapy. The introspective effects of the drugs appeal to use in psychotherapy in conjunct with therapy sessions. And studies are in progress for prescription use of MDMA to treat PTSD and depression. Now I've included a graph from the textbook that highlights the green line MDMA and the red line is GHB, two of the drugs that we're looking at. And the use of MDMA was most prominent in 2001, and then you can see that it is on the rise again. And it's funny that in 1985, MDMA was made illegal, but that's like when you start to see the spike of the increase. So now let's look at the neuropharmacology of the drug, and I'm going to focus on MDMA for this just so that all of the effects are under one label. And like we saw before, MDMA is both an empathogen and entactogen. So this drug is taken orally and it starts to work in as little as 30 to 60 minutes, and its peak is between 1 to 2 hours after use. The longevity of this drug depends on if you're taking other things with it, like alcohol affects the properties of this drug. But overall, MDMA releases dopamine, and dopamine is the feel-good or pleasure neurotransmitter. It also releases serotonin, and this is a mood stabilizer, and it is also involved in sleep, appetite, and digestion. MDMA blocks serotonin reuptake transporters, which makes serotonin more available to use. It binds to the monoamine reuptake transporters DATs, NETs, and SERTs, which prevents recapturing of these and therefore increasing the levels of them. It causes disruption in the proton gradient between the synaptic vesicle and cytosol in the axon terminal. This disruption reverses the direction of the vesicular monoamine transporter 2, and it causes pour out of monoamine molecules, and therefore they cannot be transported effectively. Selectively interacts with the 5-HT2 or the serotonin receptors. Taking MDMA also has its effects on the neuroendocrine system. It affects the system mostly by increasing oxytocin release, and oxytocin is what's responsible for those feel-good feelings and the feelings of connectedness when taking the drug. It stimulates the hypothalamic pituitary adrenal axis, which is responsible for increased heart rate and body temperature, which when combined with alcohol, these effects worsen. So your heart rate increases even more, your body temperature increases even more, and this will lead to dehydration to a dangerous level, which we'll see later on in the risks. It also increases cortisol, and cortisol is a stress hormone. And so all of these changes can affect your sleep, memory, cognition, and your overall well-being. Some of the cognitive effects of taking MDMA is where we see the classic properties of the empathogens and entactogens. So during its peak, you're going to see an increase of empathy and social behavior, where you want to talk to people, you want to connect to people, an increased confidence and self-esteem, increase in energy and endurance, and increased wakefulness. So these are all of the symptoms that would make it popular to take in a very crowded, very energetic kind of club scene environment. However, the come down, which is the withdrawal of the drug, is pretty severe. So your brain just had this spike of excessive neurotransmitters and hormones, and now it needs to figure itself out again at normal function without all of these extra neurotransmitters and hormones floating around. And this can feel like lethargy, sleep disruptions, the inability to feel pleasure, or depressive symptoms. Well, you'll have depressive symptoms. It can cause irritability and anger, also a lower concentration and impaired memory. Now let's take a look at the neurotoxicity of taking MDMA, and a lot of the available research right now uses testing from mice and rats, and this testing shows a degeneration of dopamine neuron axon terminals in the striatum, which can lead to Parkinson's disease symptoms. Although these findings have been less obvious in humans, and MDMA does not appear to be neurotoxic to the dopamine neuron axon terminals, but it does seem to have an effect on the dopamine reuptake transporter proteins. And so this can lead to an early cell death, which can then deplete the dopamine reserve and ultimately can lead again to the symptoms of Parkinson's disease. So cell death and depleted dopamine reserve sounds pretty serious, but is there some reversibility? Some studies show that some of the neural damage may be restored after a long period without use of MDMA. However, even after 1 year, some users still reported experiencing OCD, psychosis, anxiety, as well as verbal memory impairment, which leads to conversation comprehension problems, as well as problems speech production. So there are some benefits of using MDMA, and this is why the FDA has been investigating it. So MDMA is currently being studied to use in support of treating PTSD and depression. This will look like a prescribed dose, a very small dose, that is taken during psychotherapy and in the presence of a therapist. This is because MDMA can decrease fear and or anxiety when it comes to opening up about the traumas that people have experienced, and it reduces their fear of judgment when opening up about them. It increases introspection and openness to these feelings, and openness to sharing and expressing these feelings, again, without the fear of them coming back. And the idea is that the therapist can use these empathogen and entactogen properties of the drug to advance in healing, to help the people through their symptoms, rather than prescribing a temporary solution to the symptoms, which is currently what is available for treating these disorders. However, There are some risks too, and the risks include panic attacks, confusion, psychosis, overheating and dehydration, which, like we mentioned before, when used in pairing with alcohol can increase the overheating and dehydration aspect, which can ultimately lead to death. And quite a lot of deaths have been related to using MDMA when in a club or a rave setting with alcohol. In addition, pre-existing heart conditions can be affected, so it's definitely not smart to take MDMA if you have a pre-existing heart condition. And then also, some tablets sold do not contain any MDMA. They're really just filled with caffeine, ephedrine, ketamine, or another psychostimulant. So this is my project, and I hope you learned something. The next slide, I have some references, but thank you for listening.